Now, while for many COVID remains a long-term issue in the UK, the government has revoked plans to introduce vaccine passports to enter nightclubs and mass gatherings in England after the initiative was slammed by protesters and some politicians. The requirement was to come into force at the end of this month, but has been put on hold for the time being.
We've looked at it properly, and whilst we should keep it in reserve as a potential option, I'm pleased to say that we will not be going ahead with plans for vaccine passports.
These extraordinary times required necessary but intrusive measures, but I'm determined to get rid of any powers we no longer need because of our vaccine defences.
Well, the decision was made despite a recent rise in UK COVID cases, which followed a short-term decline. In Scotland, plans are still afoot, though, to make vaccine passports obligatory from October, while people continue to protest against the introduction of such measures across the United Kingdom. Well, as for new lockdown restrictions, the authorities do promise not to reintroduce them in the near future. But Boris Johnson is to soon announce a winter plan speeding up the pace of vaccination and introducing emergency measures if needed. The senior clinical lecturer we spoke to earlier said that vaccine passports on their own aren't enough and should be complemented with other measures.
A passport is only one thing. It is a piece of paper that says you have been fully immunized, no more, no less. A fully immunized person can nevertheless be infected and be infectious to other people. That's not the way to infection control. A better way to infection control is to do some assessments. Are you infected? Are you infectious? Rather than relying on a piece of paper. I can see that going forward, it is unlikely that we will need a lockdown and a shutdown like we've had. If suddenly, unfortunately, a variant were to arise, which was bypassing the vaccines, which was causing more severe disease, we may have to think of a different strategy. But at the moment, I can see how the Secretary of State for Health and Social Care can get away with saying we do not expect shutdowns again.